Welcome to the District News Special Report. I'm Shay Sparks. In today's special report, we're covering the district's response to the flu pandemic. As a part of this preparation, the Department of Health has set up a rapid response center to stage equipment and supplies from the CDC. DCNet was called upon to roll out a quick deployment enterprise solution. Mark Messer, a fiber engineer with DCNet, joins us now. Mark, what is your team's role in the district's response?
We're here today to place aerial fiber into the Department of Health building.
What is involved in bringing this DOH location onto the DCNet enterprise network?
We'll place about 3 spans of aerial cable across and place a strand from the last pole over into the building. We'll go through the building wall, bring the cable down inside the building, and place a cabinet.
What does that encompass?
We're bringing the bucket truck now up to the strand, placing rollers on top of the strand so that they can place the cable through it. This roller is a fairly large one because of the existing cables on the strand now. Now they're starting to put up the cable into the rollers. The cable's coming off the reel. It's being tensioned by the guy pulling the cable there. He's bringing the bucket truck up now. He's going to start to drill the first of 2 holes that will penetrate the wall of the building. The first hole will be for the placement of the messenger that will go through. It'll have 2 plates, 2 wall brackets on it. The second hole will be for the cable itself. He's now completing the first hole. He now has the through bolt through. He's tensioning the plates. He'll now put a thimble eye on and put a dead end wrap onto the strand. The strand now will cross the street, and it will be what we'll place the cable on. They're bringing the new strand up now as it crosses the street. They'll temporarily have to close the street for about 30 seconds to get the strand up in the air. Now he's using a chain hoist and a come-along to tension the strand, checking the tautness of it. As they put the blocks up, they'll start to place the cable down the street. And now he'll place the aerial cable through the blocks. He's placing more blocks as he goes across. This will allow the cable to be pulled from the reel into the building. Now he's getting ready to place the cable into the second hole, which will allow it to enter the building and go to our equipment. Now, the reason we were able to do this so quickly is because we had an existing loop of cable, and it allows us to enter the buildings a lot quicker that way. This is the existing splice that we're going to go into. Every cable is tagged and the splice is marked, so we know exactly which splice it is and what direction the cables are going in. As the contractor now is in the splicing van, he's starting to splice the fibers in. He'll cut the desired fibers off and reroute them into the building so that it'll provide diverse service in and out of the building.
Thank you, Mark. Hyder, can you tell us more about the district's response?
Thanks, Shay. We're here at the DOH warehouse to take a look at the preparations. In response to the H1N1 Flu Virus, also known as the swine flu, the Department of Health, in cooperation with National Center for Disease Control, has been allocating space to receive shipments. This warehouse will be the staging area for surgical masks, H1N1 vaccines, and other related medical gear and supplies. In addition, DOH is setting up a rapid response center in preparation for this and future developments. DCNet's Enterprise Network Services was tasked to provide communication services due to their ability to quickly deploy voice, data, and wireless solutions.
Thank you, Hyder. This has been a District News Special Report. I'm Shay Sparks. We'll see you next time on the District News.